Yorkers now have easier access to the RSV vaccine thanks to new statewide standing orders. Joining us now is the Health Commissioner for the state of New York, James McDonald. Commissioner, thank you for being with us. So why did your office expand pharmacists' authority to administer the RSV vaccine, and who is now eligible under this updated order?
Yeah, good morning, Chris, and thanks. So when you really think about RSV, it's one of the big three. But unlike the other big three like COVID and flu, RSV is a one and done vaccine. So when I do a standing order, what I'm trying to do is reduce one more barrier for you to get that vaccine. You know, since the RSV vaccine's a one and done, the question is, well, who needs it, right? So the people who need it the most are 75 and older. Get that one and done vaccine. If you're 50 to 75 and you have an underlying health condition, which is more people than you might think, a lot of people with heart disease, lung disease, kidney disease, liver disease, cancer, that's the other group. And then the third group is anyone in that third trimester of pregnancy. It's a great way for the pregnant mom to get the vaccine, and that protects your newborn baby. Those are the big three groups.
So let me ask you about the key risk factors that make adults, let's say 50 and older, more vulnerable to severe RSV infections.
Yeah, and so this really gets to the issue of like RSV, which, by the way, often for most of us is a common cold. For that group in 50 to 75, for some people, it's more than that. So if you're someone who's got heart disease, kidney disease, say you're being treated for cancer, your immune system doesn't work well. You know, it sounds like a lot of people all of a sudden. And this is why if you're in that 50 to 75 group, like I am, take a look in the mirror, look at your health conditions and see if you should get this one and done vaccine.
Let me ask you, how does vaccinating pregnant people help protect newborns from RSV? And if people are hesitant, are there alternative options for pregnant women or infants, let's say?
Yeah, so it's a great question. So there is a vaccine for people in that third trimester of pregnancy. And when you give it to someone who's going to have a baby, the mom makes the antibodies and that protects the baby. But if you don't want to do that, there's a vaccine for babies. There's two different monoclonal antibodies. Your pediatrician can give it to you, your newborn baby, and that's given just second or third day right after the baby's born, and that's another way to protect your baby. Keep in mind, for babies in particular, RSV is one of the more common reasons why little ones end up in the hospital. We don't want our little ones in the hospital. We want them home being happy.
Let me ask you this. This is one of our top stories today. I want to talk about, obviously, the American Academy of Pediatrics pushing back against the federal government in their guidance, saying COVID shots for children are not recommended. What do you make of all that, especially as kids now head back to school and COVID rates will tick up again?
You know, I like what the American Academy did. Hospitalization rates, for people from COVID. Yeah, the 65 and older group was the highest group that ended up in the hospital, but the second highest group is that 6-month to 2-year-old group. And we didn't see great amount of uptake of vaccine in New York State last year. So I'm hoping we see a better uptake, in particular to protect our little babies from COVID this year, because COVID's still a thing, my friend. It's one of the big three.
And as school returns, what's your department's advice on protecting ourselves from respiratory viruses?
You know, when you think about going back to school, which I'm thrilled kids are going back to school, it's an exciting time, but it's a good time to make sure, are my child's vaccines up to date? It's a requirement, which I think is important, but it's a good time to say, hey, are we up to date in everything? Because quite frankly, when kids go to school, they learn together, they spread diseases together. So it's really important to make sure the immunizations are up to date for all of us.
And let me ask you, as far as the season that you're anticipating when it comes to confusion, phone calls, just because there is so much information out there, both good and bad, hesitancy for vaccines, not hesitance for vaccines, what kind of, season are you expecting as it draws near?
I do worry about the confusion. I invite people to just pay attention to the New York State Department of Health, because we're not confused about anything, quite frankly.
Yeah.
I think when you look at sane information about vaccines, we're the best place to go for a while. And I think that's just really important to say is where you get your information. You don't want to feed your brain with junk food. You want to feed your brain with good information. And I think it's just really important to say, who am I getting my information from?
All right, Commissioner McDonald, thank you very much for joining us. We appreciate it.